A good doctor, I think, should be an expert. Of course, we are seeing this doctor for expertise. But also, I think a good doctor should be approachable. The patient should be able to talk to them. They shouldn't be stressing about going to the doctor. I love to hear when they are feeling better. And a good doctor should be there for good times and bad times. My journey to medicine actually started with the fact that I really like the science part. I really like the biology. And it was much more when I was in the medical school that I really fell in love with it. My first day in the clinic shadowing my neurology professor, and the fact that he was using all those examination techniques, looking at the MRIs and how he was approaching patients, that was mesmerizing. And that's when I realized that neurology is really for me. Also, that really led me into multiple sclerosis too, because that was the time that I could really get to see the patients, get to meet with the patients. So the patients were telling me about their journeys, where I could really get to know about multiple sclerosis from scientific, pathological, neurological baseline. A neurologist can treat headaches, seizures, loss of vision, loss of other functions. For example, multiple sclerosis. A neurologist can treat epilepsy. A neurologist can treat migraine-related disorders, brain tumors, neuropathies, other muscular disease, weakness, gait problems, walking problems, falls. These are the things that neurologists would look into. When I see a patient for the first time, this is a long-lasting relationship, and I really like to understand their lifestyle a little bit, because most of my patients end up seeing me at least once a year, but sometimes more often, sometimes every 3 months. And they should be trusting me enough to tell me even their intimate symptoms and other symptoms. So that's why I try to get to know them as a person. And that is another thing. I like to give my patients a lot of information because I really want them to take ownership of their disease. And this even includes, for example, when we are making a treatment decision, I like to make sure that the patients have a say in that treatment discussion. We shouldn't be telling our patients, this is the medication, that's it. We should be giving them options. I like that the patients can get in touch with me anytime, and I'm not somebody that they need to talk to multiple people before they can talk to me or before they can reach out to me. So I want to be friendly. So I'm hoping that my patients perceive me as friendly, approachable. That's exactly the doctor that I would want to be.